you go, but just to be respectful of everyone's time, we're going to go ahead and get started since it is after 10 o'clock. Today is going to be, well, super fun for me because I get to save my voice. And we have a guest presenter here today. But before we get started, if you guys have yet to do so, please put your email in the chat box so that I can send you your post survey. If you were at my last training, I sent the post survey today because I was out all last week. And so I was dead to the world. I didn't do anything I was supposed to do. So I did it today. So you'll be getting 2 post surveys in your email, one from early this morning and then one for this one today. So yeah, just keep your eyes open for that. And so our presenter today is Robyn James, and she is the director of the Elder Justice Center of Alabama with M4A, which is the Middle of Alabama Area Agency on Aging. So M4A is a lot easier to say.
It is.
So a bit about Ms. James. She involved local, state, and national leaders to create a new center which mobilizes communities to prevent and properly respond to adult mistreatment across the state. She previously served as the Marketing and Innovations Director, responsible for all marketing, education, and outreach initiatives, special project innovations, the fostering of community partnerships, and agency grants. She serves as a lead educator on a variety of issues that affect older adults, individuals with disabilities, and caregivers. Robyn developed and is the lead trainer for the Dementia Friendly First Responder Training Program, which is now available statewide and virtually across the country. Pretty awesome. She served over 10 years with the Alabama Department of Senior Services as the state director for several aging programs, and she created and served as the state liaison for Alabama's statewide Elder Justice Council, where she coordinated 35 agencies and organizations to develop new initiatives, laws, and public policy to protect older adults from mistreatment. She led the effort to create Alabama's Elder Abuse Protection Toolkit, which is now modeled in several states. Huzzah, that's impressive. I'm so glad that you agreed to join us today. I'm excited to hear what you have to share with us, and I know our caregivers are as well. So with that said, I'll go ahead and turn it over to you, Ms. Robyn.
Great. Thank you, Jenny, so much. And good morning, everybody. I will start by saying I have been very blessed to have been a family caregiver on 3 different occasions over the course of my 61 years. Both my former in-laws moved in with me after I was already divorced, and she had advanced Alzheimer's and he had bone cancer. And so the family really just rallied around. And then my dad had Parkinson's. He had to retire at 55. And just watching my mom go through the role as a caregiver. And back then we really didn't understand, it was mom and dad. They were spouses, they were wives and husbands. And so I learned so much. And she died at 61 as a caregiver with a sudden heart attack in her sleep. So a lot of my career has been built, again, just really, I think the Lord uses me as a vehicle. I've just always been very passionate about older adults and people of any age with a disability. And of course, those who provide the care to them day in, day out, which is their family caregiver. So I would just want to start by saying, attention caregivers, you are the difference. Thank you so much for everything that you do for your loved one. And it's just amazing that that family caregivers truly are the backbone of this country. So I love this. Rosalind Carter, who recently passed away, anytime I get a chance to share this, I just love this saying, and it really has hit home. And when you think about it, it's so profoundly true. So there are 4 kinds of people in the world: those who are currently a caregiver, those who have been a caregiver, those who will be a caregiver, and those who will need a caregiver. And when you think of that, it's just so true. Again, so thank you for being here and having me share some resources with you. I want to start by letting you all know that every county in the country has what's known as a local AAA, or an area agency on aging. And we are mostly federally funded, also state funded and local funds. But for the purpose of Alabama, our AAA network operates in all 67 counties. We are one of 5 counties, and you can call one simple toll-free number anywhere in the state of Alabama, and that is 1-800-AGE-LINE to get connected. So I'm going to start this morning by just going over our core programs and services, and then I'm going to just roll right into the new Alabama initiative, which is the Elder Justice Center, which really is a very innovative model that's never been done anywhere before. So the mission of the Aging Network is to help all individuals access information, assistance, resources that will empower them to self-advocate, live independently, and enjoy the highest quality of life. Most people think the Aging Network only serves people 60 and older. Our youngest client under one of our Medicaid waiver programs is 1 year old with autism. So for the purpose of M4A, we cover Blount, Chilton, St. Clair, Shelby, and Walker, the 5 counties surrounding Jefferson County. And so as you could just kind of see how the federal dollars flow, most of our programs are funded through the Older Americans Act. And so it starts at the federal level with the Administration for Community Living. They provide funding to all, I think there's 326 local area agencies. Alabama, there's 13. And then that money goes to the state, and then the State Unit on Aging or Senior Services distributes that money based on different funding formulas. And so this is really important to know. The first place a consumer of any age, especially caregivers, needs to call is their local area agency, because we have across the country, but in Alabama as well, we have what's known as an Aging and Disability Resource Center. And what that is if a caregiver or an individual calls the ADRC, we will screen that person for every single program, even beyond the programs that we have. So example, SNAP benefits, food assistance, veterans, aid and attendance, veteran, those kind. We screen for everything. And the purpose is to make sure that nobody slips through the cracks to receive programs and services that they're eligible for.
Question.
So some of those, yes.
Is that showing on your presentation? We only see the title page. The resources you're talking about?
Yeah, do you see that? Aging and Disability Resource Center?
No, Robyn, we only see your title page.
Oh.
Yeah, no
Really?
screens, no slides have been advanced. Have you been advanced?
Oh, you're kidding me. Okay. You still can't see it?
No, we just see slide 1.
Oh, wow. Okay. Goodness. Let me, I guess, stop share real quick and then share again.
Okay.
Let me do that. I'm sorry about that. Yeah, I've been flipping them. Let's see. I'll try this one.
All right. Yep, it looks different now.
Okay, can you see that?
Yes. Can everyone else see it?
Okay, can you all see the aging, that one?
I can, yes.
Okay.
Yes, I do. I see
Okay.
it.
Okay, thank you so much. I'm so sorry about that. So some of the key programs and services that are offered really through any AAA. I know all of you have heard of Meals on Wheels. That we kind of, it's a little different. It's called the Elderly Nutrition Program, but we provide hot and frozen delivered meals to homebound seniors, people with disabilities, and also through the congregate setting. So for our 25 senior centers. So that's us. That's your local area agency who provides those meals. So I'm gonna go through each one of these just real briefly. So most of you, I believe, are you taking care of an older adult or a child?
Adult.
Okay. So this will, I think, be really good information for you. So one really important program, if your loved one is eligible or does already receive Medicaid, we have what's known as the Elderly and Disabled Waiver Program. That's not just for older adults, people of any age. And we, state Medicaid provides the funding where all the services come into the home. So it really is for somebody who requires 24-hour care, which sounds like your loved ones do. And we can connect them with the Medicaid waiver program. And there's quite a few of them now. One of them that's really popular is the Personal Choices Program. If the consumer is on Medicaid, that allows for the family caregiver to actually choose the the caregiver. So it could be the daughter, it could be the neighbor, it could be a friend, and a monthly allowance is provided to the family to bring the care into the home. And so we have that. We have a lot of people on the Personal Choices Program. Again, they have to be receiving Medicaid or they have to apply for Medicaid. Okay, and we can help with that process. So that's any area agency in the state. This caregiver support, the caregiver is the actual client of ours. This is federally funded. We provide the family caregiver respite funding for the year, or like I think it's every 6 months. And we also, if grandparents or other relatives are legally caring for children, we can cover a lot of costs for the child. You know, football, band, Christmas, those kind of things. We can help with a lot of medical and supplemental supplies. And we do a lot of caregiver support groups. We partner very closely with Alabama Respite. And they're a wonderful partner of ours under this Alabama C.A.R.E.S program. We also do, if your loved one receives Medicare, we provide free counseling all throughout the year. All these programs I'm going over this morning are no cost to the consumer. You know, again, we have the funding for it. We have certified Medicare counselors that are actually considered the experts, and we have a back number directly to 800 Medicare. So even during Medicare open enrollment, and it's housed here in Montebello, she does all the plan comparisons to make sure that the Medicare beneficiary is in the correct plan. But if you have a loved one that has any issues with Medicare, please reach out to, you know, your local area agency. They all in Alabama have this program, every one of them. We also have a state-funded senior RX program from the legislatures. There is no age requirement anymore. And so this is for people who are have no health coverage, or they're underinsured. And we work directly with the pharmaceutical companies to get that medication. We also can provide help with medications for Medicare beneficiaries who have reached that coverage gap. So if you know somebody, maybe you have a church member or a family member, they're in their 50s, they've applied for disability, they are in need of medication. Again, your local area agency, we will connect them with this program and help cover their costs of their meds. So that could be a life-changing. If you know somebody 60 and above, this is an age requirement that has need for no-cost legal services. Again, every area agency in Alabama provides this service. They can do advanced directives, simple wills, help with Social Security. They're all contracted through an elder law attorney. And so if you don't know where to start and you don't know what kind of attorney, but this is, we refer a lot of people over to her name is Jan Neal out of Opelika. We are the only group, if you will, that the U.S. Department of Labor gives funding to provide senior employment, 55 and older. And it's a training program for 2 years. And most of our participants actually get employment after that. A lot of widows want something to do. This does not affect their disability or their Social Security. And it just really puts them back in the community, and they get a stipend for it. It's minimum wage. So this is also very life-changing for somebody who just wants to enter back into the workforce part-time. Real quick, if you have a loved one that's in some type of a long-term care facility, we have what's known as the ombudsman, and that is the advocate for the resident in that facility. I'm his supervisor. We have 2 here, and you could call. Also, we do a lot of long-term care planning. So let's say your loved one, or you know somebody, a family member, is not in a facility, but you all are thinking about maybe they require a higher level of care. We have a great guide, but our ombudsman or every area agency has this in the state. You can reach out to them and they will help you navigate, you know, is it better for assisted living? What's the cost? We have a book for our region, and I'll give it to Jenny and she can email it to y'all. And it covers Jefferson County as well. This is a new project. I actually was the kind of the founder. We got a 3-year federal grant, and this has been expanded, and the state is just now got the same grant. It's called the Panda Project, which is providing Alzheimer's and dementia assistance. It started in Shelby County. It is now in I think 13 other counties in the state, and we will start this in March again for our other 4 counties, not Shelby. This is a wonderful project that brings services into the home, no income eligibility, no cost to the consumer. We do a lot for the caregiver here. We have a lot of programs and services under the Panda Project. So right now it's in the Montgomery area, Watauga, Elmore County, Montgomery, and then Tuscaloosa and those counties out there, and it'll be in our area as well. So I just want to move right into what the Elder Justice Center offers older adults primarily and family caregivers, paid and unpaid. And this started actually as a model similar to the Family Justice Center out of Montgomery, Alabama. The founder of that is a very close partner of ours, retired Lieutenant Steve C.A.R.E.S, and he and I talked for years of the need to take, it's like a domestic violence shelter model, but specifically make it for older adults. And so we were able to get $1 million from the governor and the legislator 2 years ago to purchase a 16-bed assisted here in Montebello. So the Elder Justice Center is for anyone across the state of Alabama. And so as you can kind of see the picture there, what we envision, we serve as a resource center. It's not just for adults who have been mistreated. It's for family caregivers that, you know, face extreme burdens. Maybe they need, maybe, you know, they're struggling to get mom in and out of the bath, things like that. We have all of the M4A programs, but then we also have what's known as the Elder Justice Center. We do a lot of training of law enforcement, of caregivers, of professionals. We have an adult day health center in partnership with UAB School of Nursing. They do foot care, but we had to close the building for 4 months, but we are reopening our day program March 1st. We'll be open 3 to 4 days a week. And eventually we plan on opening a temporary elder shelter specifically up to, for older adults who are in need of emergency housing. And so we can house up to 10. And so this has never been done in the country. Every emergency elder shelter is, there's 14 across the country, and everyone is housed out of a long-term care facility. So when you think again with, you think of somebody that could get all the services under one roof, including legal help, meals, all those things. The caregiver also can get a lot of support, help with incontinence supplies. That is our vision for the Elder Justice Center. So what does I mean when I say elder, or when we say elder justice? And when we think about justice, just the word justice, we really think about a criminal response, and that is a part of it. But for older victims, it's not the only pathway to justice. Let me tell you that there's so many seniors that have no caregiver, they have no community support, and it's what's known as self-neglect. They don't have anybody that can take care of them. Many of them are veterans, and they quit going to church, so they're socially isolated, and COVID just totally exasperated the number of adults who have either experienced neglect, scams, financial exploitation, or you know, all different kinds of abuse. So sometimes when we say justice, it's helping that older adult navigate and connect to services. And so that really is the number one thing. We get a lot of calls from caregivers that they just, like I got a call, you know, they cannot afford to buy large, you know, the adult underwear. Do you all have, I said, we have 4 packs of large right now that we can provide you. Medicare, and they don't have anybody to pay for that. So I talked briefly about elder abuse. There's really 6 categories. And as you can see on the screen, and I'll tell you, there's so many scams going on right now. But for every one case that is reported to Adult Protective Services, there are 23 that are still going on behind closed doors. A lot of times, we know family caregivers have the utmost best intentions. Many times it could be the grandson who's moved in, the granddaughter who's moved in. Again, the spouse passes away. The spouse was now it's there's so many families that are known as the sandwich generation. They've had to move mom and dad in, and they're also raising kids at the same time. And so, but if you do the math, for Shelby County, 690 alleged cases were reported. Well, if you times that by 23, that's actually 17,250 older adults, I mean 60 and older, that are still, living with this going on. And so for the whole state, there was 9,900. Well, if you do the math, that's 227,700 older adults. So it's very important. People don't want to hear about it. They can't believe that, a 91-year-old veteran is being, neglected, and they're not, just all what horrendous what goes on. So we think it's our job to really raise awareness of this. Where do you report it to? People can report it anonymously. Department of Human Resources, they are the investigative arm. Similar to Child Protective Services, they have a division called Adult Protective Services. So every county in Alabama has that. So I want to share, I did some research for y'all. These are some great resources for family caregivers. And I would say beyond Alabama Respite, which is fantastic. One of them is called the Family Caregiver Alliance. If you go on their website, they have so many great, and it's not overwhelming. It's very easy to navigate. And that is caregiver.org. And also Alabama Disabilities Advocacy Program. These, again, are all statewide, because I didn't know where y'all are residing. Alabama Independent Living Council, Alabama Council on Development Disabilities, and then the Alabama Governor's Office on Disabilities. They have a lot of great information as well. And so I would highly encourage you all to go ahead and if you have access to the internet, go ahead and look those up. And then I found this on one of those websites, and I just wanted to share it. As a caregiver, you all have the right. And it says, I have the right to take care of myself. This is not an act of selfishness. It will give me the capacity to take better care of my relative. You can just read them on this. I really like this. As a caregiver, I know I'll tell you, when my mother-in-law moved in after my dad had passed away, my mother-in-law moved in, and I told family, they have a wonderful family. Everybody was very supportive. And I said, oh, I know, because dad had dementia with Parkinson's. I know how to react or how to redirect her with her Alzheimer's. What worked for my dad never worked for my mother-in-law. It was just amazing, that the difference. And so as we go and we train first responders how to become dementia friendly across the state, we use a lot of examples. And I will say that they've been, almost half of every first responder's hand goes up when I ask, how many of you have either been a caregiver, your wife's been the caregiver, half of the room goes up. They're dealing with family caregiving. So we really teach them how to also think of the caregiver when they, enter into a house. I mean, the caregiver may just be simply, they don't have enough resources. I don't know. There was one, he had to work because his mother didn't get any Social Security, and he was her only source of income. And so he had to work. And so he was in Montgomery, and that caused him to have to leave her alone. Well, he didn't understand that with her level of Alzheimer's, it wasn't safe to leave her alone. And so it wasn't that he was doing anything wrong, but we were able to connect him and really talk to his church and give him resources so that, he can have a caregiver for while he works. So just things like that, I think is very important that you all know. these services, and just start by, picking up the phone and calling, and I'll direct you. There's our statewide brochures on our website. But I love this saying too, and I love the picture of that tree, and it's not the load that breaks you down, it's the way you carry it. We are here, we stand ready to assist family caregivers, your loved one. That Panda project, I don't know, again, the geographic location where you all, but I'm going to give you a couple good websites to go to. And the one is our Elder Justice, and that is elderjusticeal.org. And we're adding a lot of resources for family caregivers on there. We're hoping to open the shelter in the next year. It takes a lot of money up front, but it's a wonderful initiative, and there's so much support. So even if you all just would need to call that number right there, I typically will, and we have 7 people working here. That's it. We can connect you to all kinds of different resources, as well as I know Alabama Respite can as well. But that's really all I had, and I just wanted to thank you all so much for letting me share these resources with you.
Thank you, Robyn. That was really eye-opening for me as well. I know we have partnered with M4A and done a lot of things, even just since I've been here, but I wasn't even fully aware of all the services that you provide. So thank you for giving us that overview.
Yes.
I do want to open it up for any questions. If anybody has any for Miss Robyn before we end today, we've got plenty of time. So if you have a question, you can either enter it into the chat, or you just go ahead and unmute yourselves and ask the question.
I'm driving, but this is Shirley. Thank you so much. Such great information. When you're thrown into becoming a caregiver, you don't know which way to turn. And there's so many resources. I really appreciate you sharing this, because I've had my 93-year-old mom now 3 years, and I'm still trying to figure out what to do. So I definitely will be contacting that number.
Yeah, and feel free to call me, and I can connect you with your local area agency. Can I ask, is she the spouse of a veteran?
No.
Okay. I always ask that question. Okay.
No. It's just me.
Okay, but yeah, it sounds. And where do you live? What county?
I am in Jefferson County.
Okay, great. Yeah, that's United Way AAA.
Oh,
And
okay.
yeah, and they have all these same programs and services. They don't have the Panda project yet, but I would say that's a great place to start. And if you want to, I can give you a great contact over there.
Okay, I will be in touch with you.
Okay.
So I'm driving
All right
now. Thank you so much.
Thank you.
And just for anybody else who wants resources from Robyn, if you, I know you put your email up there, your contact information, but if you missed it, or if you feel more comfortable contacting me, I can always put you in contact with Robyn as well.
Yeah.
Yeah.
Right.
Any other questions or comments for Robyn? Well, I've been very delighted to have you today, Robyn. I can tell just from our brief internet interaction that you are a passionate person full of compassion for others. And I just think that's a beautiful light. And so I appreciate you for coming and sharing that with us. I always get my love top up when I'm around people that are in the community, just loving on other people and trying to find resources for those of us struggling, because we all have those times in our life where we need somebody to help. We need community. And so I don't want anyone to feel as though they cannot reach out if they need something. We all need something at some time from somebody. So please don't hesitate to reach out to myself or to Robyn. If you have any questions, and maybe if there's something that you have a specific need for that maybe wasn't mentioned, please email me with questions, email Robyn with questions, and I'm sure between the two of us, if we don't have the resources, we can find out where they are for you.
Yes.
Again, if anybody has any questions, please feel free to enter them into the chat or to unmute. But also, if you have not yet put your email address in the chat, please do so I can send you that post survey. But I'll go ahead and let anybody who wants to unmute and talk to go ahead and do so. And if not, we'll go ahead and in for the day.
Excellent presentation. I look forward to getting more information on the Panda project.
Great, thank you.
Yeah, and Robyn, you said that was brand new, right? When did that start? Did you mention
Well,
that already and I forgot?
We piloted it in Shelby County, and then 2 other area agencies have since replicated it in their area. And then the state just got the award for it. So it's really going to be, I think it's going to be down in the Dothan area now. If somebody wants to email me at rjames@m4a.org, I'll go ahead and get you in touch with the Panda coordinator, if, for that county. Because it's in 7 counties in Tuscaloosa, Pickens, Greene, Hale. I'm not sure. I'd have to do a little research.
Well, and I can also include your email in the post service or post survey. That's the word I'm looking for.
Okay.
So if anyone didn't have a pen to write that down, I'll go ahead and email it to everyone that's participating today.
Great.
All right. Well, thank you so much, everyone, for joining us. I really have a good feeling about this information. I feel like it's going to be very helpful to a lot of people. Even those that couldn't join us today, we do post this as a recorded education on our website. So if you have anybody who would find this information useful, please direct them to our website and we can share this information with them as well. All right. So thank you again, Robyn, for your time. It's been a pleasure. I look forward to collaborating with you again in the future.
You
and
too.
To all of our caregivers who joined today, thank you again. I really want to push forward the idea that you guys just joining us for these trainings, it's not only a good benefit for you, but it definitely is a benefit for the ones that you're caring for. So this, even just showing up today, is an act of love and service. And I want you guys to know that we as a community are very grateful for you to step in and do what you do every day. And if you guys need anything, don't hesitate to reach out. And thank you again, Robyn. Everyone, I hope you have a wonderful Monday. Stay warm.
Oh, yeah.
Stay hydrated and stay rested. And we'll see you all next time, okay?
Thank you, Jenny.
All right.
Thank you,
Bye, everybody.
Bye.